Don't mind him.
He's endangering your chances.
Don't mind him.
Good morning, and I hope you're well.
I'm good. Once again, I'm on the road.
Okay.
So I am very, very sure that within the next maximum 1 or 2 hours, you hear of me wherever I am and what I'm doing. And that's just a teaser. And I think you are the first radio station I'm granted this interview to. But I'm very sure from next 1 hour, 2 hours going, the whole country will know where I am.
Oh, it's related to your work as ranking member on...
Yes, I'm a member of Parliament for Juaboso constituency, and I'm the ranking on Parliamentary Select Committee on Health Simple.
What is this about?
You called me.
No, I'm interested in where you are headed to.
I've finished what I want to tell you. So I think within the next 1 hour to 2 hours, you will hear from. The whole Ghana will hear where I am and what I'm doing. So
we're looking forward to hearing that. But in the meantime, I'm sure you've been diving into that report, the report of the Auditor General on the use of COVID-19 funds. I'd like to first hear your initial impressions of what you are looking at.
Yes, so now let us establish this point that it is not as though the Auditor General set out himself to audit the COVID expenditure. You recall that some of us have fought this up to this point. At a point in time, our motion was even thrown up when the first deputy speaker sat in the chair, if you recall. So we have consistently been fighting that. We think, a lot of things are not adding up with regards to the COVID expenditure, and that we need an investigation, we need a probe into the whole expenditure and all that. So for me, yes, the Auditor General has done something, but I think that it goes beyond what the Auditor General has done. And on some platforms, I have said that it is just the beginning of the journey and the tip of the iceberg, because there are certain questions that need to be answered that has not been resolved in the report. And I'll give you a typical example. You recall the country director for World Bank and said somewhere last year that Ghana has benefited not less than $903 million within 1 year. You recall that statement?
Vividly.
Very well. And if you read the Auditor General's report, around $413 million has been accounted for with respect to the IMF, with respect to World Bank. So for me, I think there are a lot of questions around that particular source. I'm aware that we had some other sources from Germany, from Korea, that have not been captured clearly in that particular report. We had other inflows that were supposed to be used for maternity issues and other related issues that they further directed that it should be used or should be part of the sources of the COVID funds. So there are a lot of questions. You recall also that in 2021, it came up that they used not less than 32 million Ghana cedis for the purposes of meeting when government had even imposed a ban on travels. These issues didn't come up strongly in the Auditor General's report. They used about 600 million in 2021 alone to purchase hand sanitizers and masks. That is also as part in some of the records we have. Again, in this Auditor General's report, about $120 million was paid to UNICEF to procure vaccines. But what the Auditor General didn't add is the fact that after the time we were paying that money, we have been giving some vaccines free of charge, and after the time, not less than 5 million doses of vaccines were available, and even some of the vaccines got expired, after the time we're making extra payment for some extra persons. And so these are issues we need to go into. There are other money that have been paid vis-a-vis fumigation of markets that have not found space in the report. And we have to find out how fumigation of markets will fight COVID-19, how recapitalization of banks will fight COVID-19, why more than 6,000 frontline health workers who contracted the virus have not been paid, who are behind the insurance companies, i.e. enterprise insurance. And so there are a lot of questions. And you see, Sina, I'm raising questions and not making categorical statements because I am a member of the health committee, and there's a joint committee that has been put together by the speaker, and we are going to start sitting on this matter on the 7th of February. And therefore, I can only raise questions. I'm praying to God that it should touch their hearts, and when they appear before us, they'll be able to resolve these issues so that we get clarity to this matter. So there are a lot of issues. I mean, as far as we are all concerned, we know that at least every constituency has an ambulance, isn't it?
Yes.
Yes. So if you hear that there is money and we are fighting COVID and we are seeking to buy 28 extra ambulances in Ghana, the issue of ambulance is not. The issue, the challenge is not the availability of the ambulance, but the operationalization of the ambulances. That is the challenge we have as a country now. So if you hear that we have paid more than $600,000 a year ago, about somewhere January 2022, and we have not even received an ambulance tie in this country. I mean, we have to. And the issue of Adakulu, treatment center, where we are told that facility has been leased to us 15 million Ghana cedis, and we have to spend about 20 million Ghana cedis to bring it up to standard for its intended purpose. These are issues I think that we need more answers to. You know, it brings to question other treatment centers. What is going on there? How much has been paid in other treatment centers? So there are lots. I think that yes, the Auditor General has done his bit, but I think there are more questions we have to probe into.
But does the report settle anything for you? Because I realize even with the insurance matter, you're still asking questions. The other issue, there are questions for you, raises further questions for you. Does it settle something that you've been wanting some answers to?
Okay, so not that much, except that, this time round, it is not the minority speaking or the NDC speaking, but their own appointee who has come to do some auditing of the COVID-19. So it vindicates our position that, after all, there was a need for some kind of investigation to be carried out. You remember, I don't know if I have told you on this interview, that there was a point in time when our motion for an investigation into this matter was thrown away, when the first deputy speaker sat in the chair. You remember that incident, right?
Yes.
Very good. So we have fought hard to get to where we are now. It's not, the man didn't set out himself to do this just like that. But we think that we must hit it slowly. We must ask more questions and wait for answers to clear everybody's mind. So there are a lot of questions. There are a lot of questions.
Then there was a point where for a moment I was wondering what had happened, because for the insurance issue, I realized saying that the government of Ghana paid money to an insurance company for people who had not been identified, who had not filled no documents, who you cannot easily account for. So the money had been paid anywhere.
The money has been paid, and one of such insurance companies, the enterprise insurance. And you know who are behind enterprise insurance? Go and ask Ken Ofoyata whether or not he knows enterprise insurance and whether or not he has shares in enterprise insurance. Monies have been paid to enterprise insurance. More than 6,000 frontline health workers have contracted the virus and they are due for payment, and not a CD has been paid to them. So who must facilitate the process of paying the payment? It's somebody's responsibility within the ministry. There's a clear contract between government of Ghana and the insurance company. Why are people not benefiting? So there are a lot of questions. If we have, gone to fumigate market, what has it got to do with the treatment of COVID? Recapitalization of banks? Where is the correlation? We must convince ourselves so that tomorrow nobody will stand anywhere and say that COVID-19 has brought us where we are facing, economic hardship. That is not true. That is palpable falsehood. That is wickedness. Because to the extent that COVID killed people and people got sick, yes, it's a disaster. But with respect to our economy, if you have any competent group of people handling an economy such as ours, and within a matter of 2 years, we have had not less than 22 billion in our economy. Our economy should be flying very, very high. At least the Auditor General, hello?
Yes, I can hear you.
At least the Auditor General has confirmed, that we have pumped not less than 22 billion Ghana cedis into this economy. At least that has been confirmed. And you come back and cite COVID as one of the reasons why we are facing economic hardship. I think that will bring that matter to a close within this week. But nobody, no Ghanaian, will stand anywhere and say that COVID has brought us economic hardship. In fact, if anything at all, COVID has brought us more money than any single community have in this country. Within a matter of how much is our syndicated loan for Cocoa? Go back and check. Maximum 1.3 billion. And within a matter of 2 years, some of the 20 what do you call it? Grants, what came from Germany, what came from Korea. And so I think that we must take our time and resolve the issues one after the other, until we are all satisfied that, look, yes, this is how the money was utilized. But, Senna, didn't you hear on tape that a former DC of this government, a former parliamentary candidate of the the money to them so that they were you didn't hear that tape?
No, we have that tape.
Benefited from the so-called SMEs. Who benefited? Who were the beneficiaries? What was the criteria? We have only asked.
Well, hello, Rabo. Hello.
I'm here.
Okay, let me conclude by then asking you, because this discussion, I'm sure, has not ended, that you hinted at the fact that you are doing some further work in Parliament. You see a bipartisan parliamentary probe that's ongoing. You gave a particular, what day are they appearing before you, and who is appearing before you?
Okay, so as far as I know, we'll start the public sitting on the 7th of February if nothing changes.
7th February?
Yes, and the Finance Minister is the first person to appear before us to tell us where the receipts and the expenditure before we take it from there.
Okay, so you start with the Finance Minister.
Whatever ministry or agency received or expended money, if the committee deems fit, will be invited.
And on this probe, you are hoping to ask the lingering questions that this report further raises.
I am hoping to clear my mind. I am hoping to clear my mind with all these questions. So as for that one, I think that the media will be there, a lot of you will be there. We must clear our minds to know that, look, this is how that money was put to use. So if you have any question, we are inviting memoranda. We're inviting, questions. We're inviting information. We've opened up. So from this time till 7th February, if you have anything, it will be welcome.
Honorable, I'm looking forward to your special assignment, the outcome, because you said I should wait, so I'll wait.
Don't worry, you wait for the next 1 hour to 2, and you know what I'm doing.
Okay.
You know, it's nothing different from what I usually do, so don't worry.
Honorable.
Yes, sir.
Sir, Bibi Abokodia.
Mumpai Bunti.
Now, me person me who say because me say June 2022 and Ken Ofriata a presentation about COVID expenditure. Na adie chen na I say after the presentation as speaker yes the finance and health committee monka mo homom na mososo munya modwuma. So are you saying say since that time ABC month we almost 7 months now mon start adwuma?
Yes, started Juma. There were some other documents we're looking for, some from the Ministry of Finance and all that. But at the point, Anna Anka, never share Juma National, and what do you call it? Budget issue nearby, and you know, budget a major issue for Parliament.
Yeah.
So your speaker. Say na iwie budget na yebeshasie. After budget, we say Christmas festivities and members of Parliament must go back to their constituencies and all that. So they are say February 7th. That time, I recall it Parliament. Not just say yebeshasie. A public hearing on that. And in fact, it's all good. It's all well and good. Say at least Auditor General so they need the aba. So. It's all well and good. Yeah. And so
and chair there because I said chair na 7 months in the or the account.
Yes, depending on where you are sitting near the chair. I'm tempted to agree with you, say but we have a program and we have a plan. Such as we have a program and we have a plan.
Okay. Yeah, the best. So, Sana ni bibia dia producers of Petra no. Over events.
Yes, expansion. Chenka producers on nka mona bo motoa na ke nyina no na say yakoto bia fa.
Me na taste here. Te say ye coffee no na kraba na me kire wife say onye no. O de onye na nwa mo kakra sisia no. Untimi ntohwe nti unya mo no kakra de anwa asom na de nchina gum. Apro na de ade enye easy sa enye easy
what be doing what
Petra na no de papa it is here me voluntarily no
honorable dia I was say me bie a shop bi already good and am be fa bi begum o
match
Intia me fro na
no be a only
way too much.
Thank you. Honorable, thank you. I think he's still on the road. He's the member of Parliament for Juaboso, is ranking member on the health committee. He says he's on a special assignment.
Yeah.
He's just returning from there. We'll hear from him shortly.
Okay.
It relates to his work as member of Parliament.
Because me try to her. Question because we see Sana we need to get serious as a country.
The time period within which
exactly because Sadio Zanka Auditor General report about COVID expenditure obia every few and the ends and for no as a